Good afternoon, everyone, and welcome to this phenomenal event, an event that I'm sure you all have been waiting to attend since 2018, because that was the last time the 6th biennial conference for these has happened. Because when was the last time you all spoke to each other? Not so long ago. But when was the last time you saw each other? No responses. Okay. Perhaps earlier today. It's my great privilege to be welcoming you here this afternoon. I'm Chetty Elston, and it's my privilege to be your Master of Ceremonies. Let me take this opportunity to welcome all you distinguished guests, esteemed colleagues, and honored members of the Ministry of Health for South Africa to the ASLM2023. We're particularly grateful to be having in our presence today the Health Ministry officials from the DRC and Uganda. Welcome. Additionally, we'd like to extend a very special appreciation to Dr. Anban Pillay, who will officially open the meeting for us this afternoon. And then, esteemed partner, supporter, and friend of ASLM, Ambassador John Nkengasong, who is the U.S. Global AIDS Coordinator and Special Representative for Health Diplomacy under the United States President's Emergency Plan for AIDS and Relief, PEPFAR. We welcome you online. It's amazing what we've learned post COVID. We now know that even though we might be physically far from each other, we're really not that far, especially since we can communicate with each other so well. Director General of Africa CDC, Dr. Jean Kaseya, we are profoundly grateful that you're able to be with us online and that you'll be participating in today's event. And on behalf of ASLM, to each and every one of you, on behalf of the sponsors and the partners, we truly are grateful that you took the trip and that you're joining us for this long-awaited conference. And it's, of course, an opportunity for all of you to connect and reconnect and experience being together again. And, of course, there's so much being delivered here. We have some phenomenal speakers lined up for you, not just today, but throughout the next few days, bringing various fields, including laboratory science and public health, clinical practices. Of course, we also have representatives from diverse sectors to discuss technological advances and policy development within the African laboratory medical field. The theme, as you now know, is shaping laboratory systems and diagnostic services for the 21st century, embracing the change. We've experienced a lot of change over the last few years, and so over the next few days, we will learn where we can go from here for the continent of Africa. And so, ladies and gentlemen, without further ado, I'd like to ask that the conference co-chairs please join me. It's Dr. Kamy Chetty and Professor Maaroufi. Another warm welcome for them, ladies and gentlemen, if you need it. Yeah, if you need it.
Thank you very much, Program Director. Co-Chair Prof. Abderrahmane Maaroufi, the Honourable Minister of Health of Uganda, the Honourable Deputy Minister of Health of the Democratic Republic of the Congo, Dr. Anban Pillay, the Deputy Director General in the South Africa National Department of Health, who's here representing the Minister of Health, who has sent his apologies, the Chair of the Board of the Africa Society for Laboratory Medicine, Dr. Patrick Matete, the Chief Executive Officer of the Africa Society of Laboratory Medicine, Mr. Nqobile and Ndlovu, the Honorable Ambassador Dr. John Nkengasong, from PEPFAR, Dr. Allan, the Executive Vice President of Africa for Roche, which is the strategic partner, honorable representatives of the CDC and PEPFAR, honorable members of the ASLM, all protocol observed. I would like to take the opportunity to welcome you all to South Africa. With over 62 million people, we all give you a very warm welcome. The country is the world's 23rd most populous nation and covers an area of 1.2 million square kilometers. We officially are called the Republic of South Africa, and we bounded to the south by 2.8 kilometers of the beautiful coastline that stretches along the South Atlantic and the Indian Oceans, and I do hope that you'll be able to enjoy this beautiful country of ours. Pretoria is our administrative capital, whilst Cape Town as the seat of parliament is the legislative capital. And you all, having been here in conferences before, know just how beautiful Cape Town is. South Africa has 11 official languages, and this colorful mix of culture gives South Africa its nickname, Rainbow Nation. We work to protect and preserve our wildlife with dozens of protected land and marine areas, including the famous Kruger National Park, as well as nearly 9,000 privately owned game reserves throughout the country. We are gathered here at the Cape Town International Conference Center in South Africa from today until the 15th of December for a groundbreaking in-person event, the first post-COVID-19 event to discover the transformative power of laboratory medicine and redefine the future of healthcare in Africa. This year's conference is organized under the theme, as mentioned by the program director, Shaping Laboratory Systems and Diagnostic Services for the 21st Century, Embracing Change. The future of this conference is apt. Whilst COVID-19 has had a devastating effect on the world and its economy, never before has the importance of laboratory medicine been as acknowledged as it was during COVID-19. And this is evidenced by the pivotal role it played in the COVID-19 pandemic. And without laboratory medicine, the world would not have been able to deal with the pandemic. In a similar manner, since the launch of the African Society of Laboratory Medicine, the ASLM conference have played a vital role in emphasizing the significance of laboratory medicines and professionals in the healthcare sector in Africa. ASLM conferences have been a decade of brilliance, boundless knowledge, and beyond. In 2012, the first conference theme was Accurate Laboratory Diagnostics, a pillar of quality healthcare, which was in Cape Town, South Africa. In 2014, the theme was Innovation and Integration of Laboratory and Clinical Systems, Reshaping the Future of HIV, TB, Malaria, Flu, and Neglected Tropical Diseases and Emerging Pathogens in Africa, in Cape Town, South Africa. In 2016, the theme was Laboratory Medicine in Africa, Combating Global Health Threats, Cape Town, South Africa. So we're beginning to see a trend here. We're very glad about that. In 2018, it's Preventing and Controlling the Next Pandemic, the Role of the Laboratory, which was in Abuja, Nigeria. In 2021, the theme was Responding to Outbreaks Through Resilient Laboratory Systems, Lessons Learned from the COVID-19 Pandemic, which was a virtual conference. And in 2023, it was Shaping Laboratory Systems and Diagnostic Services for the 21st Century, Embracing the Change in Cape Town, South Africa. So that's this year's conference. The above conference themes are a demonstration of how the ASLM conference have been designed to address current and emerging global health issues. The National Health Laboratory Service is proud to be the co-chair of this remarkable conference. As you are aware, the NHLS is a Schedule 3A national public entity in South Africa, which was established through an act of parliament. We service above 80% of the South African population through a network of 233 state-of-the-art diagnostic pathology laboratories. So we're very proud of the services. We're also involved in surveillance support for communicable diseases, occupational health, and cancer. The National Institute for Communicable Diseases and the National Institute for Occupational Health are some of our divisions. We're very proud to be part of the ASL program, including the stepwise laboratory quality improvement process towards accreditation and the strengthening of laboratory management towards accreditation, as well as LabCop. We have grown and been enriched by these initiatives. I wish you all a wonderful and safe stay in South Africa and hope that this conference will inspire you to advocate for change in laboratory medicine. Thank you.
Good afternoon, Excellencies, Honorable Ministers, Deputy Ministers, DDG, experts, scientists, and distinguished guests and participants, ladies and gentlemen, all protocols observed. I would like to extend a warm welcome to you all to Cape Town, South Africa, to this important opening ceremony of ASLM 2023. This year's gathering, ladies and gentlemen, is a celebration of innovation, of collaboration, and progress in shaping laboratory systems and diagnostic services for the 21st century. As the North African co-chair of this conference, I am honored for this title. Alongside with my sister, Dr. Kamy Chetty, it is an honor to stand before you today to make not only the beginning of this conference, but also the culmination of 11 years since our inaugural gathering. This year, ladies and gentlemen, our focus turns to the heart of innovation and progress, keeping our eye firmly on Africa, which is the epitome of resilience, creativity, and the relentless pursuit of advancement in the field of laboratory science and diagnostics. Africa, with its diverse landscapes, cultures, and challenges, presents a dynamic canvas upon which the future of laboratory system and diagnostic services can be painted. Ladies and gentlemen, we all gathered here. We would like to thank warmly the African Society of Laboratory Medicine, which has played a pivotal role in ensuring the needs of African countries and communities are reflected in the global laboratory and diagnostic agenda. The role ASLM plays as a leading advocate and convener has supported this community to make remarkable progress in laboratory sciences over the last 11 years. We have seen really advance in technology, revolutionize diagnostics, innovative methodologies, streamline processes, and most importantly, a collaborative spirit driving change across borders and across also cultures and disciplines, which is very important for this association. The theme of this year's conference, ladies and gentlemen, is shaping laboratory systems and diagnostic services for the 21st century, embracing the change. This topic encapsulates the spirit of adaptation and evolution that is indispensable in today's rapidly transforming world. It's a call to embrace change and the flexibility of adaptation, not merely as a necessity, but also as an opportunity to redefine the landscape of healthcare research and innovation. In our return to Cape Town for the ASLM conference, we have the opportunity to reflect on how far we have come in the pursuit of laboratory excellence with colleagues across the continent who have remained really the lights of inspiration. As we embark on the coming days, let us embrace diversity, harness the collective knowledge of our global community, and commit ourselves to forging partnerships that transcend boundaries and barriers. I am sure many of you will also use this time and opportunity to reconnect with colleagues and build a strong partnership and foundation of the past. Let us, ladies and gentlemen, use this platform to learn more from each other, to share our successes and also our challenges, and co-create and innovate solutions, that is, local solution for Africa, that will shape the future of laboratory systems and diagnostic services, not just for this century, but for the future generation in our continent. Over the remainder of this week, we will focus our session to a set of topics, helping to set the tone for each day. For example, tomorrow, topics will be changing landscapes for laboratory medicine, what are the challenges and what are also the opportunities. During this session, we will discuss and debate what is the impact of epidemiological, socio-economical, demographic, and environmental changes that affect and how affect medical laboratories and diagnostics for healthcare delivery in our continent of Africa. On Thursday, we will focus on meeting the challenge and taking the opportunity, which is important, this opportunity of reflecting on successes and also on challenges and unexpected opportunities. It's very important to anticipate. As we wrap up the week, we look to the future, how to transform laboratory medicine for the 21st century in our continent, conceptualizing the world we want for the future of laboratory systems and diagnostics services, networks, and discussing how we will overcome existing challenges to achieve our ambitious goals and objectives. In closing, I would like to invite each one of you to immerse yourselves fully in the rich tapestry of discussion and debates workshops, and collaboration that await us in the coming days. Let us seize this opportunity to utilize the power of change and pave the way for the future where healthcare knows no bounds and where innovation thrives. Thank you very much, ladies and gentlemen, and looking forward to the next few days filled with insights, collaboration, and groundbreaking discoveries. Thank you very much for your attention. Thank you.
Thank you. Thank you very much to the co-chairs for the African Society of Laboratory Medicine Conference for 2023, Dr. Kamy, Chetty, and Professor Maaroufi. Now it gives me great pleasure to call on the current ASLM board chair. Please join me in welcoming Dr. Patrick Mateta.
Honorable Minister of Health from Uganda, Dr. Jane Ruth Achero, Honorable Deputy Minister of Health from the Democratic Republic of the Congo, Dr. Allan Senje Emmanuel, our host, the Deputy Director General for the Ministry of Health in South Africa, Dr. Pillay, Ambassador at Large and US Global AIDS Coordinator, Dr. John Nkengasong, His Excellency, Director General of Africa CDC, Dr. Jean Kaseya, the ASLM board members here present, the ASLM CEO, Mr. Ndlovu Nqobile, the conference co-chairs, Dr. Kamy Chetty, as well as Professor Abderrahmane, Maaroufi, colleagues, ladies and gentlemen, distinguished guests here present. Good afternoon to all of you, and good evening for those that count this as evening. On behalf of the ASLM Board of Directors, I would like to welcome you all to this wonderful, exciting conference full of anticipation, full of new things. We are very excited, and it is so refreshing to finally meet again. As you all know, as a community, our last meeting was 5 years ago in Abuja, Nigeria, and because of COVID, we couldn't meet in person until now. And I can only imagine what we were feeling during those years, but the wait is now over because we are here today as we start this conference. We are here today because of the common purpose and goal we all have, that is to improve our laboratory medicine in Africa and even beyond. I am humbled with the growing partnerships and friendships that ASLM continue to stand with, the partners that continue to stand with ASLM since its inception, and the collaboration that continues to grow with each year. ASLM, as you may be aware, and for those that are not so sure, is a Pan-African organization which is really committed to achieving a healthier Africa by increasing access to quality laboratory services for all. Since its founding, ASLM has been a critical voice of the laboratory profession on the continent and even beyond, coordinating and implementing multidisciplinary, multi-stakeholder interventions including technical assistance that they have provided across the globe. When I say across the globe, for some of you, you may think I am just throwing in big words. I really mean it, because one time I actually traveled to the Caribbean, and they were talking about how ASLM has been pivotal in helping them improve their quality management system. Central Asia is not spared, and the Middle East is not spared. So it's really, although it's Africa-centric, it's really a global organization. Now, in the 12th year of ASLM, we can no longer be considered as a young organization. I know that years past we used to say we are young, but now ASLM has matured, and we must begin to behave as mature as the maturity comes with. So the organization has also greatly spread its wings across the globe and trying to reach as many countries, as many constituencies as it can. And as a board, we are committed to ASLM's strategic plan, and we are working with the ASLM management and staff to make sure that the objectives of the organizations are met. I can just mention just a few of the things that we are engaged in with the ASLM team. The premier laboratory medicine organization in Africa is what we are aiming for. We aim to be that premier organization for lab medicine in Africa. We aim to be an organization that has significant influence across the whole continent and even beyond. We aim to be a key thought leader on the global stage. And we also aim to be an organization that is spearheading innovation and driving transformative change in the field of laboratory medicine. In the spirit of representing the African laboratory professionals across the continent, ASLM expanded its office base. As you may be aware, it was originally based only in Ethiopia. But as of last year, we now have an office here in Johannesburg, South Africa. And we look forward to even expand beyond the 5 regions of our continent so that we are fully an African organization and represented in all the 5 regions of the continent. The network of ASLM staff and experts is also expanding to meet the growing programmatic needs. This expansion and growth is only possible because we continue to work closely with key global, regional, country stakeholders to strengthen the laboratory and diagnostic network in the region. The network, as I said, is growing and continues to grow. And we look forward to even some of you who are here being a part of this wonderful team called ASLM. Allow me to highlight one of the greatest resources, our strong and dedicated members. They really have put a lot. All the success that you are hearing here and all this conference, for it to be a success, we owe it to our dedicated team of ASLM members. We are proud that more than 13,000 individuals are part of our ASLM family of members. And more than 34,000 subscribers receive information about ASLM's activities and work and innovations. All of us here are important members of the ASLM community. In closing, I want to share the following commitment from the ASLM team, starting with the board and the staff. We will strive to be leaders in the laboratory science and aspire to actively and strategically engage our stakeholders to define, shape, and advance the laboratory medicine agenda in Africa. We also aim to represent the diversity of perspectives and expertise within laboratory medicine on the continent through the active listening, meaningful engagement, and delivery of culturally sensitive and context-specific assistance. We also embody collaboration, teamwork in all that we do, leaning on each other, our staff, our members, our donors, our partners, to celebrate successes and work through challenges with a steadfast commitment to respectfully and equal opportunity. We also strive to continuously improve and be efficient, and excellence being the mark of our work in all our results. We demonstrate integrity, and in getting there, definitely integrity is really our buzzword. Not only a word, but our way of doing business. We are serious about our pledge to wholeheartedly serve our fellow citizens on the African continent and are dedicated to developing solutions that reflect our values and priorities as Africans. We together will undoubtedly succeed in advancing laboratory medicine and improving access to diagnostic on the African continent. I thank you all and wish you a very enjoyable, exciting, and eye-opening conference. Thank you.
Thank you so much, sir. Dr. Chetty, Professor Maaroufi, thank you so much for joining us. For officially opening this meeting, it's been... Right now, I would like you to turn your attention to the screens. We have a video that will simply give you a little more insight into what the next few days will bring you. A video that will really encapsulate the essence of the experience over the next few days. Here it is.
Laboratory medicine in Africa today is stronger than ever before. However, Africa has been experiencing a number of new and emerging infections and other health challenges against limited and overstretched diagnostic capacity.
There is population growth, global warming, migration, and changes in lifestyle that affect disease burden. It puts a lot of pressure on our healthcare system, and especially the laboratory system, to detect health threats and to provide correct diagnostic.
There are some areas in the continent where labs have moved further along, but we still have labs in Africa where even the basic microbiology is still a challenge.
In sub-Saharan Africa, there's a particular lack of diagnostics available. We did a survey of national plans in various countries, and we found that very few mention diagnostics at all.
But then we still have challenges on implementation of national laboratory policies in countries that have policy. We still have silos in terms of programs.
Another key weakness is the lack of referral linkages that enable the broader use of all diagnostics and capacity that is available across the entire lab network, as well as weak supply chain systems.
The proportion of trained individuals relative to population size is vastly inferior to what is required and to what is currently in place in the higher income countries.
A lot of effort has been made to strengthen laboratory system and improve the delivery of diagnostic on the continent.
There has been a big push for some innovations, new technologies, and also the genomic sequencing that has proved to be a powerful tool in detecting diseases.
Diagnostic innovation is an area that can benefit most of African countries, especially with the current multiplex technology that help us to address several areas like the human resource needs.
Multiplex molecular platforms enable us to test multiple analytes from a single sample. This will help us to reduce on tests that are required, enable us to deliver diagnostic services everywhere where we encounter patients, and also reduce on resources required in the delivery of services.
There are opportunities to take advantage of new technology such as AI, machine learning, other computational methods that will enable laboratory scientists, clinicians, community health workers, etc., to do more with less.
ASLM has been instrumental in supporting the changes through provision of technical assistance to train the human resources to gain competency, but also keeping us updated of the new guidelines and innovations that are coming on board.
ASLM represents the voice of the African laboratory community and is at the forefront of moving laboratory and diagnostic testing into the future. We have recently launched a new 5-year strategy to better respond and address continental challenges effectively.
We work around 4 important pillars: improving the laboratory workforce, ensuring access to diagnostic, increasing the efficiency and effectiveness of laboratory network and system, and empowering the laboratory community in Africa.
We will be using our programs such as we have the ASLM Academy that is addressing training needs. ASLM will improve the quality of diagnostics using the One Health approach.
ASLM has also spearheaded strengthening laboratory processes towards accreditation through the SLIPTA program, which has had results in moving labs significantly towards accreditation.
Under the Mapping Antimicrobial Resistance and Antimicrobial Use Partnership MAP, we have worked with scientists, researchers, national authority, healthcare providers in order to collect, analyze, and interpret very important data on antimicrobial resistance in Africa. And this data has been packaged to inform national action plan for the containment of AMR.
ASLM is going to address the workforce challenges in a sustainable and country-owned way.
We are also gathering information on the functionality and the capacity of laboratory system and network using the LabNet scorecard or the lab mapping, which collects information that is geolocated on the capacity of laboratories. That can be used for diagnostic network optimization.
Since 2011, when ASLM was established, there has been a very, very strong alignment with the PEPFAR activities. All these systems that PEPFAR has developed over the years are now being integrated, and we work together with ASLM to ensure that they are used to be very, very impactful and supporting the continental agenda.
The ASLM initiatives and approaches align very well with Global Fund strategies to strengthen lab systems. With ASLM, African leaders have been challenged to really work on innovations, expand and scale up best practices, and provide solutions to Africa's problems.
We cannot achieve our goals alone, so strong partnerships are essential.
We partner with countries, with associations, with laboratory workers and agencies such as Africa CDC or the WHO. By doing so, we can match the technical innovation that are out there with the country demands, with the funding.
I'm excited about working with our partners on the African continent, particularly the African Society for Laboratory Medicine, the work that we have done to build learning networks such as the LabCop, which is a community of practice focused on laboratory strengthening.
ASLM remains one of the highly valued Pan-African organizations that Africa CDC collaborates with. An organization that is people-centric and develops context-specific interventions that countries can benefit from. This is the Africa we want.
The future of laboratory medicine in Africa is brighter than ever before, and I'm very optimistic in ASLM leading the way in the 21st century of laboratory medicine.
We are working with an incredible community of laboratory professionals, scientists, researchers, civil society, policymakers. They are all supporting ASLM to find African solutions to African problems through African creativity and science.
We are so excited to be working together to change the future of diagnostics in Africa.
And on that positive note, it's my absolute privilege to welcome the esteemed CEO of ASLM. Please help me in welcoming Mr. Nqobile Ndlovu. He's been leading the organization for the past 5 years now, and today he'll provide us with some insight into the remarkable journey and the progress of the African laboratory medicines field.
Your Excellencies, the Ministers of Health who are here, the distinguished guests, colleagues, ladies and gentlemen, and all protocol observed, good afternoon. I would like to start by welcoming you to the ASLM, to the 6th ASLM conference with the theme Shaping Laboratory Systems and Diagnostic Services for the 21st century, embracing the change. I'm glad and I'm also humbled to see colleagues and friends, influential, visionary, and great global leaders in laboratory medicine attending this conference. ASLM continues to excel because of the friendship and the support from like-minded institutions, like-minded partners and organizations. So in 2021, the Lancet Commission on Diagnostics published findings which showed that about half of the global population has little to no access to diagnostics. And another study in Africa on antimicrobial resistance showed that about 1.3%, only 1.3% of laboratories across 14 countries are able to perform bacteriological testing. And this is a worrying picture if we are to talk about dealing with the triple threat of infectious diseases, non-communicable diseases, and malnutrition. And again, all this is now being amplified by the climate change and frequent outbreaks. In addition, the current landscape is marred with challenges. But of course, they are surmountable. We are having challenges with fragmented data management, infrastructure, and many more. For the first time, diagnostics have been put at the front and center globally. The passing of the World Health Assembly resolution on diagnostics was indeed historic. This has been further cemented by the WHO Afro Regional Strategy on Diagnostics and Laboratory Services and Systems, which was passed this year in July. We are indeed at an opportune time to define and to change the future of diagnostics. As ASLM, we are better positioning ourselves to contribute to this change. This year, we launched a new strategic plan which had 4 pillars. Number 1, to strengthen the laboratory workforce, ensuring that populations have access to quality diagnostics, improving the efficiency of laboratory systems and networks, and lastly, empowering the African community. Now, allow me to turn to the ASLM journey
and indicate some of the achievements we have accomplished. This is not the work of ASLM alone, but all of us here. This picture is close to my heart because it shows the first lab that was audited by ASLM under the flagship program of quality called SLIPTA. It's a lab in Lesotho in 2013, 10 years ago. And what's interesting is in this picture is that we see our African hero who discovered Omicron in Botswana. Dr. Skhulile Moyo was there. And little did he know that one day he was going to make this discovery when he was holding that pen and that notepad, making sure that the continent's program for quality actually takes off. And I think he deserves a round of applause. Today, I'm happy to say that the landscape of labs getting international accreditation has improved exponentially. As you can see, we are now over 1,000 of labs accredited in Africa and still counting. And this is the work of partners, this is the work of ASLM members, and all of us here. But we still have a long way. As you can see, some regions are lagging behind, like the Central African region, the West African region, and the North African regions that are still lagging behind. For us to significantly change this gap on quality, we need to institutionalize the implementation of quality management systems at national level. Therefore, ASLM and Africa CDC developed this blueprint for sustainable quality implementation. And we are seeing countries leading the way in implementing national laboratory certification program. We want to congratulate and celebrate these countries. 14 countries have already started to establish a national external quality assurance program, and this, again, we want to celebrate. Workforce development is an important component in addressing access to diagnostics. According to the Lancet Commission on Diagnostics, there is still an estimated gap of over 800,000 workers that are still needed. However, it is not only the numbers that are a challenge, but also the skills. And this is where ASLM is currently putting its effort. In a recent survey that ASLM conducted, about half of the laboratory professionals have little to no access to any opportunities of continuous professional training. The ASLM Academy has stepped up to the task to address this challenge, currently providing CPD and qualification courses. And some numbers, very exciting and very encouraging, are coming, with nearly over 10,000 certificates that we have issued. And ASLM is not limited to this continent. Our reach is even beyond Africa. In 2017, ASLM brought together countries with a vision of sharing knowledge, sharing best practices, and co-creating knowledge. And this was through a flagship program called the Laboratory Systems Strengthening Community of Practice, which is affectionately known as LabCorp. Currently, 22 countries are coming together. And through this program, they have generated and co-created at least 7 short guides on best practices. But these best practices will all be in vain if not converted into plans. Actionable plans are typically those that are funded. I'm happy and glad to note that at least 82% of the best practices are now linked to funding through different mechanisms. For all these to be sustainable, country ownership is a non-negotiable. We are proud that as ASLM and Africa CDC, we have what we call a Laboratory Directors Forum. The Laboratory Directors Forum seeks to bring together African continental leaders in laboratory services to shape the laboratory agenda, define priorities, harness individual countries' strengths and capabilities and success to further build laboratory capacity in Africa. We currently have 42 countries, and the directors have collectively come together and defined their priority areas, and these are documented in a call to action. And in April this year, the laboratory directors, they met to push the agenda on diagnostic integration. This is the report that you see on your right. Colleagues, diagnostic network optimization is the way to go if we are to do more with less. And we are already seeing encouraging updates. 70% of diagnostic network optimization in sub-Saharan Africa includes HIV and TB within their scope. And we now need the scope to increase beyond the additional HPV, hepatitis, and COVID, which is already happening in a number of few countries. And again, beyond optimization, we need countries to prioritize their context-specific diagnostics. Countries have been working tirelessly to develop their national essential diagnostic list. At the moment, right now, currently 2 countries have published their national essential diagnostic list, which is Kenya and Nigeria, and 4 have advanced drafts, and several with equivalent but still need to be updated. Ladies and gentlemen, the future of diagnostics is incomplete without talking about genomics. The Africa Pathogen Genomics Initiative is the flagship program that has significantly made progress over the last 4 years. Capacity of genomics has grown from 7 in 2019 to 30 in 2023. The dream is for the whole continent to have this capacity. At continental level, we have made significant strides in terms of biosafety and biosecurity. We now have a 5-year strategy, and we have developed a regional training and certification program that is already yielding results. We have 3 centers of excellence, 1 in South Africa, another in Tanzania, and soon 1 in Senegal. And we have trained over 200 and certified these professionals, and this is happening in 37 countries. As ASLM, we are proud of our journal, the African Journal for Laboratory Medicine, AJLM, that continues to serve as a mouthpiece of all the brilliant work that we are doing in the continent. We have over 400 publications now. And this journal continues to grow. It has been indexed, and it has an impact factor of 1.1. The question of access and health security of the continent will remain unanswered until local manufacturing of diagnostic products is established. A survey by PATH clearly shows that there is limited capacity of manufacturing in the continent. I'm very glad to acknowledge opportunities that are coming to address this gap, the efforts from PEPFAR, from Global Fund, from UNITAID, and from the Africa CDC, AUDA NEPAD, through the Diagnostic Advisory Committee, where ASLM is a member. At this point, I want to highlight the high, encouraging political support. However, there is need for capacity building, especially in the area of research and development, and of course, addressing policy changes that support local procurement, among others. I would like to conclude with this important slide that sets the tone for the future important discussions. Regional and global partners are now engaged under a new initiative that is called the Future of Diagnostics. This initiative, the Future of Diagnostics, aims to identify, to prioritize the key enablers, opportunities, and solutions that could facilitate achievement of improved future diagnostic services in Africa, with a particular focus on new approaches and ways of implementation that will accelerate progress. Another important question is, how do we demonstrate progress on addressing all these gaps? Could there be a way of combining all the different matrices into one measure and index that we can use to benchmark for investments in all diagnostics? I would like to take this opportunity to thank all the partners here who have supported this conference, with a special mention of Roche, who are our strategic sponsors. All of us here are ASLM members, so I want to invite you to visit our booth and upgrade your status to be a Lab Pro member. I thank you.
Thank you very much, Mr. Ndlovu. Our next speaker could unfortunately not be in the room with us today, but thanks to, of course, the new love we have developed for digital technology, he's still able to address us here. So we are really grateful that he's made himself available. So please join me in welcoming Ambassador John Nkengasong, who is the global health luminary of extraordinary achievement. His remarkable leadership as the ambassador at large and US Global AIDS Coordinator, and his ability to secure 400 million COVID-19 vaccine doses during times of great scarcity while he was the director of the Africa Centers for Disease Control and Prevention was truly exceptional. As a World Health Organization Special Envoy, he has exhibited outstanding global leadership, and so the ambassador's contribution has earned him accolades such as the Global Goalkeeper, a Times 100 list nominee and honoree, and Fortune magazine's World's 50 Greatest Leaders. He's been recognized by Bloomberg, by the US CDC, and received prestigious awards, including the Virchow Prize for Global Health and the African of the Year Award. That's a big one. Please, I ask that you turn your attention to the screens as we welcome to address us now Ambassador John Nkengasong.
Good afternoon, and let me extend my greetings from Washington to all of you. As you all know, I have been a key supporter of ASLM and continue to be a fan of ASLM. As the CEO and the board chair highlighted, we are all ASLM members. Ladies and gentlemen, let me start by acknowledging the dignitaries that are present here today, including the ministers, honorable minister from DRC and from Uganda. Let me also recognize the presence of the Director General of the Africa Centers for Disease Control and Prevention, Dr. Jean Kaseya, the co-chairs of this conference, as well as the leadership of ASLM. And let me pause here to thank them for putting together such an astounding conference. In 2018, when we met in Abuja, I was honored to give a keynote address on the lessons we learned from the 1918 pandemic. At that time, I shared 7 lessons. And just keep in mind that we had no COVID at that time, and that was 1 year before COVID. And we all discussed the importance of laboratory. And today, I would like to shift my attention and look at the 21st century laboratory medicine practice in Africa, what we had then, now, and in the future. Essentially, before I do that, I would like to start with a thought-provoking slide, which essentially says the 21st century global health situation imposes a crisis and makes us, find us at a crossroads. The cartoon that you see on your screen shows you where global health is, and somehow we arrive at a roundabout where we can go somewhere, we can go anywhere, or we can go nowhere. So why is it so? Before I dive into the core of laboratory medicine, where the continent has been, is now, and in the future, let's pause and look at the challenges of the 21st century we are looking at. This slide summarizes for you what I characterize as syndemics, which is simply where several linked, interreacting, and synergistic affections contribute to excess burden of disease. And in this case, in Africa, we are looking at emerging and re-emerging infectious diseases, the endemic diseases such as HIV, tuberculosis, and malaria, and non-communicable diseases that are on the rise. And there are several factors that are giving rise to these syndemics, and some of those have been touched on during the opening remarks. They include the increased population, and on the top left-hand corner of the slide, you see the population of Africa projected to be 2.5 billion in 2050, which means in short 30 years, 1 in 4 people on the continent in the world will actually be an African. Increased urbanization, increased movement of people, conflicts, climate change are all factors that are contributing to the syndemics that I explained in the previous slide. But compound to that are also emerging technologies like artificial intelligence, the challenging physical space, food insecurity, which are all complexing and conniving with mass movement of people, conflict, and climate crisis to make global health a crisis and put us at the crossroads. Just let's share a few slides to highlight some of the challenges that I mentioned. Antimicrobial resistance will continue to be a challenge. The World Bank estimates that by 2050, about 10 million people will be dying of antimicrobial resistant related deaths if nothing is done. If you look at the slide with the red carefully, at the bottom part, which is the green color, it shows you the current number of deaths resulting from AMR. And in red, it shows you the projected number of deaths or estimated number of deaths by 2050. On your left-hand side, it shows you the loss in economy that will incur or result from AMR, about 3.4 trillion GDP loss per year by 2050. And for the continent of Africa, I would just like to invite you to look at the two bottom bars. It shows you where the continent is. The rate of antimicrobial resistance only compares to Southeast Asia. And as I've indicated earlier, currently about 1.2 million deaths occur every year because of antimicrobial resistance. Because of the changing climate change and environmental factors, emerging and re-emerging infectious diseases are occurring more frequently. This slide shows you a mapping of the occurrence of Ebola outbreaks since 1976. If you look at when Ebola occurred in 1976, and the next time it reappeared, it was 19 years. That is in 1995. Then it took 12 more years for the second outbreak to occur in 2007. But since then, we've seen that the frequency of occurrence of Ebola had decreased over time, and at times occurring several times a year. And the geography has expanded. In 2014, we saw a massive outbreak of Ebola outbreak in West Africa, which took all of us by surprise because it showed up in capital cities. Then we are currently dealing with COVID and have dealt with COVID for the last 3 years. And these pictures are not images taken in 1919 from the Spanish flu. They are images that were taken during the COVID-19 pandemic. That is a pandemic of our time. And estimates suggest that about 20 million people have died because of and due to COVID-19 pandemic over the last 3 years. We're also dealing in global health with the issues of non-communicable diseases, in particular hypertension, where if you combine the deaths resulting from hypertension on the top panel and you compare them with infectious diseases, you clearly paint a picture of what the threats that non-communicable diseases poses in the world, but very importantly in Africa. I call it the rising tides of non-communicable diseases. The HIV/AIDS epidemic is not over. Our goal is to bring HIV/AIDS to an end as a threat by the year 2030. We've made significant progress, as you can see in the rates of new infections have decreased steadily since the peak in around 2000, but we are far from getting to where we need to be. We are also faced with the issue of malaria and the emergence of other vectors like the Anopheles stephensi, which has just emerged and is spreading across Africa. And the danger of this vector is that it's spreading drug-resistant and diagnostic-resistant malaria across Africa. The global health landscape is faced with a rising crisis of mental health. The WHO estimates that in 2020, about 264 million people suffered from depression globally. Those are all part of the global health crisis that we are facing with. So where does the laboratory fit in this? In medicine in Africa fits in this. In the next few minutes that I'm left with, I'll try to review for you what the continent has gone through in terms of improvement in laboratories over the last 2 decades, where the continent is now and where the continent should be and could be heading to. Just to start with, I would like us to review a book that was written by one of the brightest minds I've worked with on laboratory medicine in Africa, Professor Eruka Okeke. She published this book in 2011 and titled it Divining Without Seeds, The Case for Strengthening Laboratory Medicine in Africa. In that book, she said very important things, but I'd like to invite you to read this slide. It says, infectious diseases is the most common cause of illness and death in Africa, yet health practitioners routinely fail to identify causative microorganisms in most patients. As a result, patients often do not receive the right medicine in time to cure them promptly, even when such medicines is available. Outbreaks are larger and more devastating than they should be, and the impact of control interventions is difficult to measure. Wrong prescriptions and prolonged infections amount to needless costs for patients and for the healthcare system. That was true then in 2011, just almost the time ASLM was created, and is true today. We've published a series of papers acknowledging the progress that the laboratory medicine has made over the years in Africa. Some of these studies or perspectives were published in the Lancet, co-authored by Chetty, who I'm sure is present in the room, and other top leaders on the continent. So I will not dwell a lot in the past, but suffice to show some progress that thanks to the partnership as highlighted by the leadership of ASLM, PEPFAR, a program that I'm honored to lead, has contributed in supporting partner countries in Africa to strengthening laboratories steadily since the beginning of PEPFAR the last 20 years. And as of today, over 4,100 labs are being supported across the continent. We have also seen, in the spirit of laboratory diagnostic networks, a lot of progress that have occurred on the continent as we strengthen capacity to support HIV and TB laboratories, how laboratories have emerged and continue to support the work that we do in HIV. But these laboratories are being leveraged every day in supporting other disease outbreaks, including COVID and Ebola and cholera outbreaks. I think Ndlovu mentioned this, that one of the turning points or game changers on the continent has been his work in strengthening laboratories and guiding them towards accreditation. The graph on my right-hand side shows you the steady increase in laboratories that have achieved accreditation on the continent through the strengthening of lab management towards accreditation, SLAMTA, which are called one of the best innovations that have occurred in the lab thanks to people like Chetty, whom I consider to be a genius and a devoted compatriot in the world of laboratory medicine. If you look at this slide carefully, in 2009, very few labs were accredited in Africa, and that is when SLAMTA was launched. And as you can see clearly, many countries in Africa have done what previously was considered impossible. That is accrediting labs to international standards. And overall, SLAMTA have supported over 1,600 laboratories in 56 countries in Africa, Asia, Latin America, the Caribbean, to be accredited. Another game changer in the landscape of laboratory strengthening in Africa was the creation of ASLM. And this is 2011, where in Addis Ababa, a series of ministers met with a continental political leadership to launch and unveil ASLM, which today we continue to celebrate its success. So where are we now? When COVID hit in 2019, it exposes the continent in a way that we thought we had made progress, but we still knew from COVID that we needed a lot of areas to be strengthened. This slide is telling because it shows you on my right-hand side where the continent was, even as of August or September of 2020, where only 30 million tests on a continent of 1.4 billion people had been conducted for COVID. That was a situation that doesn't bode well with health security, and a situation that had to be changed. I take this opportunity to recognize the heroic effort of people like Dr. Yeno from the Africa CDC, where he was, in my view at that time, a relentless hero in setting up laboratory capacity across the continent to enable capacity for COVID diagnostics. And this graph shows you the timelines of which and how the diagnostic capacity was implemented in Africa. By February 2020, only about 2 countries in Africa had the capacity and capabilities to test for COVID. But by August 2020, most countries in Africa had established capacity to test for COVID. Before COVID, absolutely no country in Africa was producing a diagnostic test. But during COVID, the Pasteur Institute in Senegal started producing a rapid diagnostic test for COVID. In Morocco, we saw the rise of innovation and where a PCR test, in my view, one of the best PCR tests, was produced in Morocco and was used across the region, including in other parts of Africa. However, we have to look into the future and ask ourselves the question, where does a continent of 1.4 billion people go from here? I would like to offer 3 pathways the continent should embrace laboratory medicine. One is in the manufacturing, as the CEO mentioned. Second, in genomic surveillance, and third, in artificial intelligence. And I would just like to walk you through each of these. So let's start with manufacturing and why Africa needs, what is the case for Africa to embark on manufacturing diagnostics. As the title of this slide suggests, we cannot allow pandemic memory loss from COVID-19 occur on the continent. So there are at least 5 reasons why Africa needs to embark on the journey of manufacturing. One is to create a shorter, more diverse, more resilient supply chain in the spirit of collective health security. Second is to create potentially faster access to regional relevant innovation, to provide flexible capacities or capabilities for global health emergencies, and to create economic development and opportunities for the continent and for the world. And lastly, to incentivize strong local and regional regulatory capacities. At PEPFAR, we have made a commitment during the African Leadership Summit in December 2022 that PEPFAR was willing to buy up to 15 million HIV rapid tests if they were produced in Africa by Africans for the African market. We also made a commitment that by 2030, PEPFAR will be willing to buy up to 2 million ARVs if they are produced in Africa by Africans for the African people. So what do we need to accelerate regional manufacturing? We believe there are three pathways we must engage simultaneously. One is to shape the market, coordinate procurement across large buyers, donors, and domestic governments towards a sustainable African manufacturing business model that will enrich a global or a regional market, not just of the 55 nations, but with an eye towards exporting to other regions of the world. Second is to build a robust regulatory system, operationalizing and elevating regional regulatory structures such as the African Medicine Agency, commonly called AMA, to harmonize regulatory decision-making and accelerate the development of an African waiver list to be leveraged by countries and donors. We at PEPFAR are eagerly looking forward to this, and we look forward to a very strong partnership with the Africa CDC to make this happen. Thirdly is to access financing. We are willing to work closely with the continent to create linkages with indigenous partners on the continent like Afro-Exim Bank and the ADB to enable low-cost production of diagnostics on the continent for the African people. And as we embark in this journey, it's important for us to be innovative and to look at a multiplexing approach where instead of producing silos of rapid tests, you're looking at a multiplex rapid test. And this is a slide that I borrowed from a colleague, Christian Rizzo, where it essentially shows that you can use one cartridge to analyze and diagnose several diseases. That's the kind of innovation and the kind of future that we should be looking at into the future as the continent engage in manufacturing. Let me now turn my attention to genomics. And why should Africa embark on strengthening its capacity for genomic surveillance? First of all, emerging diseases threats in Africa will determine the trajectory of the continent's development. And genomic surveillance is the first line of defense to identify pathogens and monitoring emerging threats before they become pandemics. Second, the future of medicine is precision medicine. However, less than 3% of existing participants in genomic-wide studies are African. And future healthcare in Africa must rely on cutting-edge precision medicine tools. And lastly, fueling leadership in medical innovation, genomic surveillance is necessary infrastructure to support research into new diagnostics, therapeutics, vaccines for diseases that are endemic on the continent. There is absolutely no way the continent will succeed in manufacturing both therapeutics and vaccines if the genomic capacity is not strengthened. So we published a series of papers previously highlighting the importance of genomics on the continent and the challenges and opportunities that it offers. I will not dwell into that, but rather offer a framework of thinking as to how such genomics could be established. First of all, we have to deal with the capacity issues: personnel, equipment, and research expertise, coordination for sample collection and data sharing, and innovation in terms of new hardware and analysis tools. During the COVID pandemic, the Africa CDC showed us the way on how pathogen genomics could be coordinated. They established a tiered system to cover the continent and shared sequences or capacitate the continent to produce genomic sequences and understand the COVID variants. I begin to ask myself the question if it's not time to establish the Africa Center for Excellence in Genomic Networks that will not only focus on pathogen genomics, but also look at human genomics and link that up to the Africa CDC and other centers. This is a beautiful network that was set up in crisis during the pandemic and was able to generate in a very short period of time almost 57,000 genomic sequences for us to better understand how COVID-19 was spreading on the continent. And you can see here how it was distributed across the entire continent, which is, a hallway, and it shows clearly that laboratory medicine had come a long way in Africa. And this effort needs to be sustained, strengthened, and promoted. In terms of artificial intelligence, I'd like to draw your attention to a book and really invite you to read this book authored by Mustafa Suleiman. He's a pioneer in artificial intelligence, and he published this book recently entitled Technology, Power, and the 21st Century's Greatest Dilemma, The Coming Wave. And he says in this book that AI is fascinating and that biotechnology is going to shape biotechnology and how it has and will continue to sweep over humanity in a wave that will improve our lives and change our society in several ways. It's a book that I've read several times and truly encourage that you read it as well. But let me bring the story home. Just a few, this year actually, in October, just a few months ago, one of African Society for Lab Medicine's leader, Pascal Ondouad and colleagues, Erasmus, published a paper in ASLM, one of the prestigious journals, and it entitled is Taking the Train of Digital Health and Artificial Intelligence to Improve Medical Lab Services in Africa, key considerations. In that paper, they argued that the integration of digitization and AI into lab medicine certainly has the potential to improve accuracy, efficiency, usability, and productivity of lab services, and I can't agree more. So if we have to do that and achieve the goals published in that paper by Pascal and others, there are 5 areas of transformative potential for AI intelligence in lab diagnosis. One is the inaccurate and inconsistent results. Large volumes of data will be required. AI would help us solve the problem of time-consuming tasking, the limited expertise that exists in lab, and the cost and revenue constraints there. Those are all of potentials that AI might offer for the continent if approached rightly. It's not a magic bullet, but it's a technology that is here and is here to stay. Just to give you some example on the statistics, what AI is suggesting. On the left-hand side of this slide, it shows you the growth of AI in terms of economic gains. And between 2020 and 2030, we project that there will be about 38% increase in revenue from the AI industry. And this value addition, tremendous value addition in diagnostics, where it can lead to 34% improvement in diagnostic accuracy, 30% reduction in false positive, plus 20% reduction in false negatives for mammograms, 9% annual growth of AIs in lab medicine, and 60% reduction in laboratory testing time. So a potential that needs to be harnessed, and that the lab medicine in Africa needs to jump ahead of the curve and start planning for the future. Let me review for you a study that I found remarkable. And this is a study that was published by Liang Zhang and others from the university in China and as well as the UK, where they look at a systematic analysis of artificial intelligence for COVID-19. It's a systematic review, and they ask themselves a basic question as to what is it that the artificial intelligence could do in COVID for diagnostics, estimation of epidemic trends, prognosis, exploration of effectiveness and safe drugs and vaccines, and the potentials that it offers and limitations. And there are 3 outcomes of this. First of all, let's look at what the AI did in this study, and it's a systematic review in terms of predicting epidemic trends for COVID. And this study summarizes this slide summarizes 9 studies. And the objective is to estimate daily, weekly, and on monthly basis infection trends, infection rates, deaths, and cumulative cases. And it's looking at the error rates. And as you see on the right-hand side of this, the results section, it shows very low error rates ranging from 0.35% error rates to about 2.5%. And with very high accuracy ranging between 92 to 97%. Then the authors turn the question around and look at AI predicting prognosis of COVID-19 and summarizes 10 studies and found a high sensitivity and specificity. Again, the objective here is to predict severity of COVID-19 and mortality risk. And as you can see on your right-hand side, it shows sensitivity, specificity, or accuracy ranging between 77% right up to 98%. Then they turn their attention to AI and X-rays. And the question here is, can AI identify correctly chest X-ray scans for COVID-19 and distinguish them for pneumonia? And as you can see on the right-hand side, the accuracy range from between 75 to up to 97%. And most of the studies, with the exception of the 75% sensitivity, range from 97 to 98% to 99%. For those who are HIV, working in the HIV area, I guess the question is what has been done in that area. And a study was published in Nature recently, actually in 2022, last year, where they look at applying machine learning and predictive modeling to retention and viral load suppression in South Africa HIV treatment cohorts. And essentially they showed that this model, AI and machine learning can offer a predictive model on how to identify individuals who are at risk for disengaging from care and not having viral load suppression. I think in an area where we are striving towards the end goal, which is to bring HIV/AIDS to an end as a public health threat by the year 2030, incorporating AI and machine learning into 3 cascades is a challenge and an innovation that the HIV community must embrace. And lastly, AI is being simplified into smartphones. And what you see on your screen here is a visual taken for cervical cancer diagnosis in remote areas of Kenya, and showing you the ability of AI very quickly to actually transform the landscape of lab medicine, just as cell phone transformed communication in Africa. And it's technology that we must embrace and embrace early enough. However, if the continent needs to embrace AI, there are at least 5 areas that the continent must take into account in order to democratize AI use and ensure equity. One is the data culture. The continent must embrace the need to collect data for clinicians and warehouse this data in a way that the data represents the continent when AI and machine learning is applied. There's need for regulation and standards so that appropriate rules, guidelines are in place to ensure ethical and accurate use of AI. Adopting local solutions where you utilize local developers to better prioritize and adopt solutions for self-reliance. Funding of targeted AI health startups and connecting them to entrepreneurs and investment is an area that must be focused on. And lastly, infrastructure that will be required to drive the AI revolution for lab medicine in Africa. To conclude, let me just end with this, that transforming lab medicine in Africa will require the full force of diplomacy variable geometry, where it will require cooperation, coordination, collaboration, and effective communication across all parties. And it is not only for the continent, but partners like us, like PEPFAR and others are on standby to cooperate and collaborate with ASLM, the Africa CDC, the African Medicine Agency, to bring and harness the full power of lab medicine for our global health security for the future. Let me just end on this, that the lab medicine folks should also have a political hat. Peter Piot, one of the global health leaders, wrote in his book in 2015, and he says, science does little good when it operates independently of politics and economics, and politics is worthless if it rejects scientific evidence and respect for human rights. As the lab medicine in Africa continues to position itself as the central piece of global health and global health security, it must also make sure that it brings in the political leadership all the time, not some of the time, but all the time, so that the whole lab agenda is championed by the political leadership of the continent. Thank you for the opportunity to speak with you this afternoon, and I look forward to a very successful ASLM conference.
Thank you very much, Ambassador, for joining us here this afternoon. I'm not from the scientific fraternity, but I thoroughly enjoyed that presentation, and I'm excited to know where it takes all of you into the future. I'd now like to take this opportunity to ask you to continue to keep your attention on the screen because we have the Director General of Africa CDC doing the presentation now. I ask you to please put your hands together and help me welcome His Excellency Dr. Jean Kaseya.
Good afternoon to all of you. Let me first recognize my sister, Dr. Jane Nqobile, Minister of Health for Uganda, my brother, Dr. Allan Serge Emmanuel, Deputy Minister of Health in DRC, my brother, Ambassador John Nkengasong, who just made the brilliant presentation, the Deputy Director General, Minister of Health, South Africa, the ASLM board chair, and my brother, Nqobile Ndlovu, the ASLM CEO, and all of you colleagues who are attending this gathering. Greetings to you all from Africa CDC in Addis Ababa. I would like to apologize because I cannot be there physically with you because of competing priorities. I highly recognize the importance of this gathering under the title Shaping Laboratory Systems and Diagnostic Services for the 21st Century, Embracing the Change. The conference theme chosen is reflecting the critical element of the pandemic prevention, preparedness, and response that Africa CDC is considering as our key priority. Excellencies, ladies and gentlemen, our continent responds on an average of 2 new outbreaks per week. 2 new outbreaks per week. For instance, from January 2023 to December 2023, today, we already have documented 163 public health threats, with an average of 75% of them being zoonotic and amplified by the impact of climate change and high level of antimicrobial resistance. All of these diseases, outbreaks, even the recent COVID-19 pandemic, put the critical role of laboratory systems on spotlight and exposed the serious weakness in the laboratory systems of African countries when, at the start of the pandemic, as reminded by the CEO and the Ambassador John Nkengasong, only 2 countries have capacity to test COVID-19. Access to the medical countermeasures, including diagnostics, continue to be a major bottleneck for our health security. As you know, Africa is manufacturing less than 1% of our vaccines and less than 5% of diagnostics that we are using. Excellencies, dear colleagues, this is the reason why a number of you saw me calling the African local manufacturing agenda of medical countermeasures, including laboratory diagnostics, as the second independence of Africa. Why I call that the second independence of Africa? It's because manufacturing our medical countermeasures will ensure our health security, will ensure our economic growth, will ensure the job creation, and will also contribute for the peace and security in Africa. Last week, I was in Accra, where Africa CDC managed to convince the Gavi board to secure $1 billion for African vaccine manufacturers. This is the game changer, and this is what is making this agenda a reality. In the area of diagnostics, I want to thank PEPFAR and Global Fund for the wonderful discussion that we had and the vision that we are sharing to make this low-hanging fruit become a reality. Recently, Africa CDC, in collaboration with the African Union Development Agency, AUDA NEPAD,
has established the Diagnostic Advisory Committee to facilitate the regulatory approval process for diagnostics. ASLM is part of that. This process will serve as a building block for the newly established African Medicine Agencies, AMA. We know today that Africa is not well represented in a global health architecture, and enough resources are not allocated for the health system strengthening effort, including building the laboratory systems in Africa. This is why our third International Conference on Public Health in Africa, called CPHIA 2023, which was concluded in Zambia a week before, was organized with a theme of breaking barriers, repositioning Africa in a global health architecture. We are working hard. We are working very hard to change the status quo. We are working, all of us, to better positioning Africa in the global health architecture. Excellencies, dear colleagues, in Africa, we have learned from COVID-19. We must give much attention to and invest more on early warning, surveillance system and response, laboratory system, and digitization of data collection tools and processes to handle future epidemics. We are also thinking about increased sustainable domestic resources. Our hands cannot just be open to partners. We need to start to contribute to build our own health systems. The current status of access to quality laboratory systems in Africa, that is home to almost 20% of the world's population, is not acceptable. Knowing that, in my new deal for Africa CDC, we are promoting to build the molecular diagnostics and pathogen genomic sequencing capacity and capabilities in Africa. That is one of our major flagship initiatives. Dear colleagues, despite multiple challenges that we are facing in Africa, there are also good practices observed during the COVID-19 that we are capitalizing on. For example, the establishment of the Africa Pathogen Genomic Surveillance Network under the Africa Pathogen Genomics Initiative is a notable achievement that we need to celebrate. This network that involves network of public, private, academic, and research institutions is allowing African countries to come together. And let me share with you, for the first time, thanks to this network, more than 150,000 pathogen genome sequences on international portal standards were reported, including the detection of Omicron variant. I was celebrating Professor Moyo, and I'm so happy that today the CEO, my brother, is also celebrating Professor Moyo. We need, as we said in Zambia, we need to start to celebrate our heroes. I would like to take this opportunity to congratulate my colleague, Dr. Yeni, who is the director of the laboratory network in Africa CDC, and his team for the excellent work they are doing to support the implementation of this critical area and to make our vision becoming a reality. I want also to express my gratitude to the board chair and the CEO of ASLM and the whole colleagues supporting ASLM for the wonderful work that they are doing and for the number of initiatives and coordination mechanisms to advance the agenda where we are together, Africa CDC and ASLM. I'm celebrating today this exemplary collaboration and partnership. I would like to urge all of us to make use of the ASLM conference to learn best practices, to share experience, and to use the opportunity to create networks and partnerships that further advance laboratory services in Africa. To conclude, Excellencies, ladies and gentlemen, dear colleagues, as we know in Africa, when you are invited to a party, to an event, you have to bring your gift. What is my gift today? I got a request from my brother, the CEO, Nqobile, for an office in Africa CDC. They wanted Africa CDC to allocate an office to ASLM for them to be close, not only to Africa CDC, but to be at the center of the capital of public health in Africa, because Addis Ababa is hosting Africa CDC. Therefore, I have the greatest pleasure to inform you that today I have instructed my colleagues to allocate this office to ASLM. This is my gift for the wonderful job that ASLM is doing. With that, I wish all of you a very successful conference, and I thank you.
What a gift. Mr. Ndlovu has the biggest smile on his face. I'd love to know what you're thinking, but I'll ask you later. Thank you so much to Dr. Jean Kaseya for his address. I'm now going to ask that Dr. Susan Sabada please come and address us. She's the interim chair for the Laboratory Directors Forum, which is an ASLM and Africa CDC initiative. Maybe she has the inside information for us about that. Did you know about that before you came?
The Honorable Minister of Health from Uganda, Honorable Jane Ruth Acheng, the Deputy Minister from DRC, the Deputy Minister from South Africa, the CEO of ASLM, Ambassador John Nkengasong online, the Director General of Africa CDC, the leadership of ASLM, all laboratorians present, all protocol observed. It gives me great pleasure to stand here as the interim chair of the Laboratory Directors of Africa to give my remarks during this official opening of the biennial ASLM Conference 2023. We want to thank the African Society for Laboratory Medicine that launched the Laboratory Directors Forum in partnership with Africa CDC for Disease Control and Prevention in Addis last year in 2022. It's the first one of its kind, and it's a platform that is officially recognized by AU member states and African Union to bring together the African continental leaders in laboratory medicine from the 55 member countries to shape the laboratory agenda, define priorities, and harness individual countries' strengths, capabilities, and success to further build the laboratory capacity in Africa. As you've already heard, as Africans, we believe in African solutions that are created by Africa. And so the Laboratory Directors Forum will help transform laboratory best practice in Africa. And our core business is bringing the leaders in the laboratory services to shape the high-level agenda for the laboratory systems for the continent, to define the priorities, harness some of the individual countries' success, and enable the forum to constantly exchange knowledge and information for the senior leaders. The move was aimed at providing a peer-to-peer environment to bring together African leaders in laboratory services and to provide space, infrastructure for laboratory leaders to develop a unified voice to shape the agenda, define priorities, and harness the individual countries' strengths and capabilities.
The Lab Directors Forum will allow country perspectives to emerge more effectively on priority areas that are relevant to the agenda of the countries and African member states, so that they are brought to the attention of both the regional and global laboratory stakeholders. As the global laboratory stakeholders set up the bridge to close the gap for access to diagnostics in communities, the Laboratory Directors Forum is an opportunity to bring our unified voice from the laboratory governance aspect to accelerate this, so that we have acceleration progress towards universal health coverage and the IHR requirements. Our forum is expected to contribute to the adoption of best practices across the continent and strengthen laboratory systems at the national and the regional level. It's a very timely forum because it comes at such a time when at the 76th World Health Assembly, a diagnostic resolution was passed to strengthen the diagnostic capacity towards advancing universal health coverage, health equity, to address access, affordability, and quality of diagnostic tests, and expanding accessibility of diagnostics up to the primary health care level. It also comes timely when Africa CDC has come up with priority areas to support diagnostics so that it supports the new Public Health Order for Africa 2063. We also all aware that the most emerging and remerging challenges for public health in Africa over the next years include emerging pathogens, new health threats that can lead to the disruptions in diagnostics, unequal fragmentation of services, and leading to inaccess to diagnostics and critical shortage of laboratory health workforce. But as laboratory directors, we are also deeply concerned by the continued investments in only vertical disease programs and testing capacities that are very disease specific without enabling greater integration that results into suboptimal capacity, reduced efficiency, limited ability to introduce additional tests, and hence increased cost of health services. So therefore, as the Laboratory Directors Forum, we believe that this is indeed a timely venture as we move forward to shaping the laboratory systems and diagnostic services for the 21st century as we embrace the change as our theme today for the conference. And we believe that the African continent and the world at large is looking at us not only to support attainment of accurate and timely diagnosis, but also to provide guidance to inform short and long-term solutions. So, as laboratory directors, we call upon the national governments, working in collaboration with development partners and implementing partners, to support our forum. We also call upon all the national governments to create conducive policy and governance environment for laboratory and diagnostic systems by creating laboratory departments or directorates to drive the laboratory agenda back home. We also call upon the national governments, donors, and partners to break the silos and take lead in diagnostic integration and actively transition from funding and supporting vertical disease programs to a more integrated diagnostic system. We want to see support in the global health security agenda, non-communicable diseases, neglected tropical diseases, to mention a few. I want to thank you for listening to me. Thank you so much.
Thank you so much, Dr. Sabata. And now, without further ado, to officially open the conference, the ASLM conference for 2023, please do welcome to join me the Director General from the Ministry of Health for South Africa, Dr. Abderrahmane Pillay. Anban, I've always gotten your name wrong. Welcome.
Jerry. Thank you very much for this invitation. So I deliver this speech on behalf of the Minister. Honorable co-chairs Dr. Chetty and Professor Maaroufi, the Honorable Minister of Health of Uganda, the Deputy Minister of Health of the Democratic Republic of Congo, Dr. Nkengasong, who's online, the DG of Africa CDC, the executives of ASLM, the chair, as well as the CEO, and all the other senior officials at ASLM, distinguished guests, invited speakers, chairs, sponsors, organizers, and ASLM delegates, all protocol observed. Let me first deliver the apology of the Minister. He was unable to be here today, as Murphy's Law would have it. There are many competing events. As you may know, today is also the World UHC Day, and we're also hosting the BRICS TB Summit in Durban at the very same time. Let me also first welcome you to South Africa and to Cape Town. We've ordered the best weather for you while this conference is going on. I wouldn't have said that last week when we had a heat wave, but this week promises to be a really good weather. And we also hope that you would have a very memorable and robust discussion at this year's ASLM. I stand before you today at a moment of great significance as we convene at the ASLM conference, an occasion that transcends the ordinary, bringing together minds dedicated to the transformation of healthcare in Africa through the lens of laboratory medicine. As we gather within the vibrant and resilient city of Cape Town in South Africa, the significance of this moment is not lost on us. We stand at the dawn of a new era, the first physical post-COVID gathering that symbolizes our shared commitment to rediscover, reimagine, and redefine the future of healthcare on our continent. The foundation laid during the first ASLM conference in 2012 themed Accurate Laboratory Diagnostics, a pillar of quality healthcare, has been instrumental in driving laboratory medicine. Professionals from diverse backgrounds shared knowledge, experiences, and had initiated discussions that catalyzed the progress. And today, we embark on the ASLM2023 conference. You celebrate 10 years of tireless dedication, collaboration, and progress in advancing the frontiers of laboratory medicine. The theme of this year's conference, as you heard, is shaping laboratory systems and diagnostic services for the 21st century. Embracing the change serves as both a compass and a call to action to all of us. In the shadow of the global pandemic that tested our resilience, the need for change is more apparent than ever. This conference, with its theme echoing the spirit of adaptability and innovation, invites us to collectively explore the transformative power that laboratory medicine holds in reshaping our healthcare landscape. As we engage in discussions, share our insights, and charter the course for future, let us not only embrace the change, but become the architects of healthcare paradigm that is responsive, inclusive, and dynamic. The Maputo Declaration of 2008 committed African countries to elevate their laboratory systems, and the ministerial call for action at ASLM December 2012, championed by the then Minister of Health, Minister Aaron Matsoledi, outlined key areas of action. The impact of these efforts has been nothing short of revolutionary, particularly in the realm of HIV laboratory medicine. Can you imagine dealing with HIV without a strong laboratory medicine capacity? The subsequent years witnessed a remarkable metamorphosis, with substantial improvements in diagnostic services, network infrastructure, and institutional capacity. The formidable challenges posed by HIV became a catalyst for change, leading to the development of comprehensive national laboratory strategies and policies. One of the pivotal outcomes has been the development of a competent workforce, a cornerstone of any robust healthcare system. The emphasis on training has not only addressed the immediate need of HIV diagnosis, but has laid the foundation for a skilled cadre of professionals capable of tackling a spectrum of health challenges. And we knew during COVID, South Africa was one of the countries that were able to identify a number of variants simply because of our laboratory capacity at the time. The resilience built through the investments in HIV and TB diagnostics proved invaluable. The lessons learned from tackling high-burden infectious diseases have applied swiftly to respond to the crisis. ASLM's commitment to strengthening laboratory medicine was evident as it continued to work with African countries, supporting the implementation of the ministerial call for action, even in the face of unprecedented challenges. Quality management systems have been pivotal in sustaining the gains achieved. Initiatives like the stepwise laboratory quality improvement process towards accreditation, SLIPTA, and strengthening laboratory management towards accreditation has provided a structured framework for continuous improvement towards the provision of quality health services. The impact has been substantial, with an astounding number of laboratories in Africa guided towards meeting international standards. I think you saw that here earlier. As we celebrate these achievements, it's essential that we also acknowledge our challenges. Transportation delays, equipment maintenance, and diagnostic treatment gaps demand our continued attention. However, with the foundation laid and the momentum gained, we stand at a juncture where we can only overcome these challenges, but chart a course for even more resilient and responsive healthcare systems. The 2023 World Health Assembly resolution on strengthening diagnostics aligns seamlessly with our collective efforts on the African continent. The global endorsement underscores the universal recognition of diagnostics as the cornerstone of effective healthcare systems. Its emphasis on strengthening diagnostic services, promoting innovation, and building resilient laboratory systems mirrors the very essence of ASLM's endeavors. The commitment to harmonization, quality assurance, and capacity building articulated in the resolution mirrors the principle that has driven our progress over the past decade. Moreover, the WHA resolution serves as a catalyst for increased collaboration and partnership, principles that have been fundamental to the successes we've achieved. The global community's commitment to supporting countries in strengthening their laboratory capacities, promoting research and innovation, and ensuring access to diagnostics for all resonates strongly with our aspirations for a healthier Africa. COVID has reminded us that the entire global community is only as strong as its weakest link. Your gathering today emphasizes your commitment towards transforming the landscape of laboratory medicine to effectively serve the African population. We cannot ignore the importance of engaging, deriving, and implementing effective solutions towards strengthening laboratory medicine across our beautiful, rich African continent. I look forward to participation in the various conference sessions with promising research articles that I've seen in the program. I wish you all a fruitful conference, and the compliments from the organizations on the selection of topics that all the logistics arrangements that the organizers have made. Together, I think we can all conquer. All the best for the conference. Thank you.
Thank you, Deputy DG. Would you mind staying with me for the next panel? Up next, we have the ministerial panel for the session on implementing the WHO resolutions and diagnostics. And the theme here is really strengthening diagnostics into actionable policies and practices. And so I'm going to ask that Dr. Jane Ruth Okere please come and join our DG on Health. This is Uganda's Minister of Health. Please do join us on this formidable panel. Please join me in welcoming her. I'll also ask that Dr. Serge Emmanuel Holm please come and join me. This is the Deputy Minister of Health for the Democratic Republic of Congo. Thank you so much. And now let me introduce you to the moderators for this conversation. First is Dr. Iruka Okeke from the University of Abidjan, an esteemed expert in diagnostic research, and Dr. Kenneth Fleming, affiliated with the Lancet Commission for Diagnostics and notable for his contribution towards enhancing diagnostic practices. From the looks of it, we will begin with Dr. Fleming. Please welcome.
Thanks very much, and for the organizers for inviting us here today. 23rd of May, 2023. That's a date which is seared in my mind and which should be also seared in your mind, because that's the day of the WHO resolution on the importance of diagnostics. It's been mentioned several times already, but it provides a huge opportunity. The first time diagnostics has really been on the global political agenda. So we must seize that opportunity to address the many problems that have been mentioned already today. And therefore, I was really very pleased to have the opportunity to be a co-chair of this panel today to discuss some of the issues around how do we, in the title of this particular session, implement the WHO resolution in its policies and its practice. So it's a great pleasure to have the opportunity to co-chair with my co-chair, Professor Iruka Okeke from Nigeria, from Abidjan, and to discuss this with our three very distinguished panel members who have been already introduced. So I'm going to start by asking one question, really, and handing over to Iruka, who's going to, I think, you're going to ask the first question, aren't you?
I am. Thank you very much, Ken. It's a real pleasure and honor to be on this stage. Ken and I would like to stand on existing protocol. We're really honored to have the opportunity to talk to three leaders on the African continent. Maybe I'll start with Your Excellency, Deputy Minister of Health of the Democratic Republic of Congo. By signing on to the resolution that Ken just mentioned, DRC has committed to strengthening diagnostics. Can you give us some idea of what the current level of diagnostic access is for the people of DRC and where the improvements are most needed?
Thank you very much. I'd like to start by thanking Mr. Nqobile, because it was a long trip for me and long journey. By the end of the day, we made it. And then I will start with a pledge, because when we met in Malabo, I told him, when you talk about ASLM, as a radiologist, I pledge to add ASLM-R for the radiology also. Why? Because during the session before, and what our people saw me, I was taking movies, all the problem that has been raised here can be extended to radiology department. I came from a private sector before coming in the Ministry of Health, and all the problems that was raised today can be expanded to equipment in radiology because it's also part of the diagnostic. Why do I make that pledge? It's because, coming back to my country, as you may know, the Democratic Republic of Congo is a big country of 2,345 meters squares with 9 borders. So it means that when we have public health issues, it spreads quickly to the other countries. And one of the things that we had in the country today in terms of diagnosis is that we have common outbreaks, as you may know, and I was happy to see that Ambassador Nkengasong will be talking about the outbreak of Ebola in Congo, because it was the first country to discover it in 1976. But having such outbreaks gives us also opportunity to have a kind of experience. Because today we have human resources that are trained to have a quick response and a quick answer to the outbreaks, which is something very interesting for us. But also because the country is big, it means that when it comes to plan or for a budget, while different countries can have a scale of 1, we have it 10 times more. So you can imagine the type of challenges that we have, given the fact that in the eastern part of the country we have having war, and with weak health systems it brings us pressures. So with that context and that situation analysis in Congo, you may imagine that implementing all the recommendations of the WHO is quite challenging for us. Because in the meantime, we have to deal with different issues like outbreaks, like all the presentations. I was really happy to see that we have the same problems around Africa, because it's all about TB, HIV, communicable diseases, and all the different diseases that are coming. So for us, implementing all those recommendations are quite challenging, because we have to put a lot of budget with limited resources, with political instability, and then also a lack of workforce. For instance, let me tell you that for a country, for example, when you look at the number of specialists, when you look at the recommendation of WHO, we are far below the numbers. For example, radiologists, we have only 100 radiologists for more than 100 million people. So it means that in the remote areas of the country, we don't have a specialist. It's the same for labs also. When you expand, that's why I was pledging with the R, because when you look at that problem for the labs, yes, we can have microbiologists or specialists in labs, but the country is so huge, but all the critical species of the country, we're not having a lot of people to implement it. So, but we have also an opportunity in the country, because we're launching universal health coverage, and we started 2 months ago with free birth and neonatal health. And also we got actually a leadership in the country that is pushing to have the full coverage of universal health coverage. So it's an opportunity for us to implement all those recommendations, and we did a lot of, we increased our budget in health. As we may know, the recommended budget is 15, but actually we are around 11% of the budget, which is significant. And we hope that the day coming will address all those issues. Thank you.
Thank you so much, Your Excellency. Ken, let me hand back to you, because you actually co-chaired the Lancet Commission that then fed into, formed the basis of the World Health Assembly resolution that was introduced by Deputy Director General Pillay. And that commission included, in addition to diagnostics, imaging, which, as the Honorable Minister says, is really important. Can you just very, very briefly, for members of the audience who may not be aware, just tell us what the key points are in that resolution?
Yeah, thanks. In fact, I was going to say, and most people who know me will recognize when I say diagnostics is not just IVD. But the two main areas are diagnostics, IVDs, but also imaging. And I just wanted to flag that because it's really important, as it's just been said. Much of what the Lancet Commission outlined as being the problem and proposed solutions has been covered already today. I'll just focus on 2 or 3 things. First of all, ballpark figure, about 50% of the world does not or has no or little access to any diagnostics. I'm not talking about PET MRI, I'm talking about simple urine analysis and so on. And I know you're very familiar with this, but that's 50%. If you look at primary health care provision in low and middle income countries, that figure drops to 20%. In other words, 80% of the population has essentially very little or no access to diagnostics. So that was one of the key messages. And that primary care was particularly the biggest area. Second thing was that if you looked at, we did some calculations using some 6 conditions as exemplars. And if we improved the access to diagnostics up to about 80 or 90% for those 6 conditions, we would save something over 1 million lives a year, which is twice the number of malaria deaths per annum. So there's an enormous opportunity and enormous potential to make a real difference. The other thing is, I should say, is I can hear the ministers of finance saying, wait a minute, who's going to pay for this? So we also did some analysis of cost-benefit analysis, and it turns out for the 6 conditions we looked at, all of them were positive cost-benefit, ranging from 1 up to 24 to 1. So this is not a cost, it's an investment. And that's a very important message. And the last thing I would want to say, we looked at the different stages of the patient pathway. And if patients get diagnosed, the great majority get treated. And that's a very important lesson. If we can improve the number of patients getting access to diagnosis, then we improve the number of patients who get treated. So that's a very important thing. And just to finish, we had 10 recommendations. I'm not going to go through them, obviously. But 2 I'm going to flag up. One was the biggest single problem was the invisibility of diagnostics. And we had to do something about that. And the World Health Assembly resolution was the outcome of that. That was our recommendation, that they should do that. We have to get it on the political agenda. Again, as I said earlier, this is an opportunity. We must not drop this ball. We must seize this opportunity. And the second thing I'm going to say is that this is a long-term problem. We're not going to solve this in the next 3, 5, 10 years. So we need to have a continuing long-term planning system or a forum for working on this. And coming back to ASLM, I've been delighted to hear this afternoon the various plans that ASLM and the partners at African CDC and so on are planning, the laboratory directors. This is exactly what needs to be done, a long-term planning for how best to improve diagnostics. So, in short, there's a huge problem, but there are potential solutions and there are ways forward, and we have an opportunity. We've got some visibility, so let's not waste that opportunity. Have I finished there? Okay, well, move on from that, and actually, having said all of that, I want to turn to Dr. Pillay, Deputy Director General for South Africa Ministry of Health. We're elated that you brought us here and are hosting this. Why did you think the resolution is a good step for the African continent? What do you think is, what's the opportunity it raises for you?
I think resolutions offer an opportunity to then mobilize around particular areas of work. It draws attention to issues that countries need to focus on. It also supports in terms of the funding that needs to happen. And I think guidance comes from various organizations about how you could then implement some of those measures. I think simply talking about it without a resolution doesn't concretize and formalize the issue as well as a resolution does, because when you quote a resolution, particularly in a political context, you then have a response from your Ministry of Finance to say, well, we need to support this because clearly there is a commitment to the issue. Yeah.
Thank you. Thank you, Aruka. Could I just say, actually, before I move on to that, a very important point, the resolution was sponsored by Eswatini, African country. It was the first one who took on responsibility for supporting and working hard to get the resolution through. So that was a really important thing that happened. It came from Africa.
Thank you, Ken. Honourable Minister Acheng, I mean, Ken hinted about the funding challenges here. First of all, very little of what is actually devoted to health is spent on diagnostics. How are we going to rebalance expenses within the health sector in order to give more to diagnostics so that we can have savings in other areas?
Thank you very much for the question. Allow me also to add my voice to appreciate the resolution that was taken. It was timely. We all know that health is wealth, but we are also very much aware to the fact that health is not cheap, and therefore you cannot attach a price to life. It is therefore pertinent that all our African nations take this issue very critically. And I like the fact that visibility was emphasized, and it is important that diagnostic services are prioritized by all our African countries. Every disease, every outbreak requires diagnosis so that it can be handled appropriately. Without the right diagnosis, we waste resources. However, we are not new to the fact that many of our African countries have limited resources and the priorities are many. But investing in diagnostics is not a waste of resources. It actually saves resources, because once you have the right diagnosis, then you do the right thing. It is therefore imperative that our African countries allocate budgets to diagnostics. We don't have to sit and wait for the international communities or allocations from Global Fund, from PEPFAR, from Gavi, etc., for us to begin to make our diagnostic services visible. It needs to begin from within the country. Recently, I learned a very interesting phrase, that we should stop agonizing and begin reorganizing and begin organizing ourselves. So within the limited resources that we have, we can prioritize diagnostic and imaging services and make them more visible and allocate budgets. And then further to that, we can go ahead and begin the advocacy. And advocacy requires statistics, the right statistics, to make our finance ministers understand that when we invest in diagnostic services, we are actually saving the countries billions of shillings that would have been wasted in wrong diagnosis. And therefore, it is important that, research is done in that area so that we can know what the return on investments would be. It is an investment, as we clearly heard from the Lancet Commission on Diagnostics. And so, for me, I would like to urge all our African countries that we begin by organizing what we have and making the laboratory services more visible. And then we go on to advocate, strengthen the systems by having strong regulations, and train the people that we have to build capacity, and then get our governments to put in resources. I thank you.
Thank you.
Thank you, Honourable Minister. And that's music to my ears, if I can say so. Can I just follow that up and back the Honourable Minister, Dr. Holland? What do you see, having heard this, what are the next steps for the DRC, and how can ASLM help you in that?
Thank you. As I said, for DRC, we have taken those recommendations from WHO, like a guideline to follow, because the problems that were highlighted in those recommendations are really the things that we face on a daily basis. For us, the next step, for example, when I talk about giving a free maternal birth and neonatal treatment, it was based on the fact that our ladies and kids were dying for poor diagnostic. They're dying for hemorrhages and high blood pressure. So we prioritize those two areas of health because we think that curving the problems on those two areas will allow us to increase or also to improve our diagnostic system in the country. So that's why, as I said, with the political leadership that we have actually, which is supporting us, we increased, first of all, our level of budget in health. So it means that we invested also in the primary healthcare centers. So we built 1,000 in the country because there was a lack of centers in the country. And now we are investing on equipment and then the different steps of diagnosis. And I'll come back to what His Excellency said. It's a real challenge for us because it costs a lot. When it comes to invest in terms of medical equipment, it puts us under pressure because we have limited resources, and I said also a lot of pressure given political unrest and war in the East. But the willingness is there, and we set that priority in our agendas. It's one of the things that we are going to address because there is a lack of all the factors that was highlighted here, workforce, infrastructures, roads, because a country like Congo, when it comes to logistics, the cost of logistics comes 10 times or 20 times more, which gives us also another pressure. But the good thing is that because it's a real problem that is in our political agenda, we're taking those issues like priorities. And what I will add also is that we're working on all those situations and all the discussion with the Ministry of Finance, as you said, because and I'm not happy to hear it coming from you, also because we have the same challenge. When we set budget for investment in health, sometimes they take it like an expense, while it's an investment. So that's the key turn for us to explain to the body of the ministers and the government that every dollar that we will put on health will bring an impact on our GDP. So we're working on that, and it's really a big, how do you call it, emergency for us to address. Thank you.
Thank you. So diagnostic development is a multifaceted activity, and there can be real challenges bringing different stakeholders together. Honorable Minister Acheng Ochero, who else is contributing to the essential diagnostic list development in Uganda? Who still needs to come to the table? How will they be convened? How is diagnostic development going to be choreographed in your country, and who leads?
When we talk about diagnostics, I would approach it from strengthening collaborations, partnerships, the private sector, without leaving the communities behind, because they are very important stakeholders. So that would need a multi-sector approach. Let me begin with partnerships. Many of our African countries depend on development partners and implementing partners. And so we not only leverage the strength of partnerships, but we also utilize what they bring on board with an understanding that we are all working together towards a common cause, and that is building resilient systems. And so it is important to have partners on the table for us to discuss the needs of the country, based on the country's strategies and what the country feels should be prioritized. We cannot leave out the private sector because they contribute a lot in complementing government activities, including handling the manufacturing aspects. And today we have heard a lot about manufacturing in Africa, manufacturing diagnostics, the rapid diagnostic test kits, the molecular test kits, and so on and so forth. But also ensuring that access to laboratory is within reach of the population. When I talk about the communities, I especially want to emphasize on the community health extension workers, who are the first level responders in this aspect. And they can do a lot in ensuring that point of care tests actually reach the communities, whether it is door to door or where they can easily access it, that is the first level response facility. And many of the community workers, be they extension workers or village health teams, have over the time been trained, especially in the use of rapid diagnostic tests for communities, but also in ensuring that they report timely when there is any event that is of an unusual nature, so that it is quickly detected. We cannot leave out the non-governmental organizations and the civil society, who are extremely important as well in this response. But ministries, departments, and agencies of government also need to come in and support, especially the departments that are handling diagnostics, because various disease components need widespread efforts, especially when it comes to communicable diseases and non-communicable diseases that we are now seeing on the rise. So those are some of the partners that would like to have on board.
Thank you, Your Excellency. So what role will laboratory directors specifically play in coordinating all of this?
First of all, the laboratory directors are leaders. And leaders have to set the pace for others to follow. They have to inspire the others to understand that what they are doing is the right thing. So first, their roles would be in governance, setting policies, having guidelines in place, training, and ensuring that that capacity is rolled down to the level where it is required. But also, the second and most important is ensuring that good advice is given both to the higher level technical leaders and political leaders for purposes of policy formulation and for purposes of budgeting, because they are the cooks that will bring this information that can later on be filtered by the immediate political leaders to the heads of states to ensure that budgets are allocated. And it is important that they also develop forums where there is discussion and research that is necessary for decision making, and also institute data collection mechanisms that can be accessed in real time, again, for policy formulation. So as I said before, they lead and open doors for the right things to be done as regards policy. Thank you.
Thank you, Your Excellency. Before we wrap up, I'd really like to hear from Deputy Director General Pillay on what the next steps that South Africa will take to improve diagnostic access and deployment in this country.
Yeah, I think, I mean, there are various levels of obstacles in terms of access to diagnostics. I think there are those diagnostics that are quite expensive, and so people are not able to access them. And I think trying to negotiate much lower prices so that they can become unaffordable, particularly in the public health system where patients don't really pay for their diagnostics tests. It's provided as part of the public healthcare system. I think that would be important. I think secondly, in terms of trying to bring together the strengthening of the public healthcare system together with the private healthcare system through this national health insurance bill that we have, where we would have a collaboration of the public and the private system to deliver healthcare services, where there are laboratory systems both in public and private, where we could effectively use the capacity that exists on both systems to be able to deliver services. I think that would be key. It would also support the human resources aspect of that. I also wanted to make a comment relating to budgets, if I can. I once was speaking to a group of clinicians talking about the issue of diagnostics. And they raised an interesting point, and I think we often don't appreciate that perspective. When patients interact with the healthcare system, their expectation at the end of the interaction is that they should receive some form of medication. That's the objective of their interaction. And so clinicians would cut back on doing a diagnostic so that they could provide the patient with some sort of treatment, even though the treatment may not be the best selection simply because they didn't do the diagnostic. But because they faced with this rationing process, they in their minds try to do that. But very rarely will you find a clinician saying to a patient, I'm not able to provide you with any treatment because there's no laboratory test that I can do. Until I do the test, then only will I prescribe you treatment, right? A clinician will use their clinical acumen and decide what would be the appropriate treatment and prescribe as such. And I think that's part of the problem in terms of trying to raise awareness about diagnostic medicine. Thank you.
Thank you so much, Your Excellencies. I think we really have the message here that we have a lot of advocacy to do, not just to the leadership, but more generally. This has been a very forward-thinking discussion about what we hope will be a diagnostic revolution across this continent. It's been great to hear how having the World Health Assembly resolution has actually empowered our leaders to do something about diagnostics and the critical role that lab directors have to play in leadership, as well as the need to bring in other people from within the health sector, right down to community health workers, and to think about things like logistics and roads that we often don't think about when we're talking about the health system. And then also the importance of, if I may quote you, Your Excellency, stopping agonizing and reorganizing to pull in domestic funding into diagnostics. Ken, are there any other big lessons that I left out here?
I think the future starts today, here. Apart from that, no.
Honorable Minister Acheng Ochero, Honorable Minister Holland, Deputy Director Pillay, my co-moderator Ken Fleming, and I want to thank you for giving your time and your insight to this panel. We thank the audience for their rapt attention, and we wish you a great ASLM 2023.
I'd now like to ask that the calendar, the scientific program calendar for the next few days, please be put up on screen for us all to see, if you have it with you, as I acknowledge the ASLM 2023 Scientific Committee. One of them has just been on stage, Professor Ikura Okeke, who was facilitating and moderating this current session. But I'd also like to acknowledge someone very important, Dr. Pascal Ondoa, who is the Director of Science and New Initiatives for the ASLM. If they could both stand so that you can see who put your program together. Come on, little royal wave. These are the two women who have put your program together for the next few days, and you're going to find it tremendously fulfilling and insightful. You're not as shy as that, are you? I should bring you both up again. All right, ladies and gentlemen, I'd now like you to please join me in welcoming our strategic sponsor, Roche, a strong partner in ASLM and the laboratory medicine community. I'd like to ask that Dr. Allan Pamba please come and join me on stage as we begin to close with some entertainment.
Thank you. As you can see, I brought my own microphone from home. Honorable ministers, distinguished guests, ladies and gentlemen, all protocols observed. It is the graveyard shift. I know you've been sitting for the better part of 3 hours. I will try and make this as short and as painless as possible. But listen, we've had a lot of things. My task here is very simple. Probably take it 300 feet helicopter view and leave you with some reflections, primarily focused on why are we here and what will it mean having been here. We find ourselves living in Africa at a time when the continent is dealing with a quarter of the global health burden, with just 1% of the global health budget and 3% of the global health workforce. Specifically, on the topic of this conference, we also find ourselves coming from countries where 2% or less of the existing health budget goes into diagnostics. For you and me, we are shielded from these statistics. But for the majority of the people, while you are sitting for 3 hours here, they are as real as a heart attack. And those people are not far. They served you coffee during your tea break. They're cleaning your room right now. When you go back, you're going to find a clean room. Many of them will go to hospital and they'll get their diagnosis when it's too late. And often it's by the naked eye. It's stage 4 cancer. There's not much we can do. It's a stroke. There's no intervention. Africa is today living a dual epidemic of disease. We've turned the corner a little bit on malaria, tuberculosis, HIV. We've barely scratched the surface on NCDs, as we are seeing. There's a bloodbath going on right now. And I speak very passionately about this because, like you, I know people in the village, people who may be a little bit removed, who have collapsed and died. It's probably a stroke or a heart attack. People who have stage 4 cervical cancer. No intervention in the health system today. And a lot of these people are being buried without the dignity of a proper diagnosis of what they've gone with. Okay. That's happening in our time, you know, when you and I are doing what we are doing, or current stations. It's a big challenge, and often it feels like boiling the ocean, but we cannot be tired, because if we don't do it, then who will do it? If we don't change it, then who will change it? And that is the question. How do we change those statistics for Africa? I think there are 2 key things that have resounded for me today. One is about how we lead. And we heard very clearly, we have to lead with passion, with courage. We have to, lab leaders, we have to show the direction. We cannot wait to be told what will be tested or what should be done. We have to set the pace. So one is how we lead, and I think the second one is how we collaborate, how we partner. It's time to break away the partnerships that are transactional. I come and call you a partner, but I'm just looking to see how can I use you to get what I want. To more strategic partnerships where we can see win-wins for each other, and I celebrate your win, and you celebrate my win. So it's about partnerships, and it's about how we lead. And it doesn't matter how big or small your station is. We had, early this year, there's a big roar coming from Africa. And you know, in Africa, in the jungle, where the lion roars, everybody pays attention. And that roar came from a tiny, one could argue, kingdom called Eswatini. And we all coalesced around it and amplified the voice. And today we have the resolution on diagnostics. Doesn't matter how big or small you are, if you're courageous and you're determined and you're leading, you get result. So I say kudos to Eswatini for having led the way they led. I say kudos to every Minister of Health from Africa, both here and anywhere else, who went to Geneva and voted for this resolution, even without knowing how you're going to pay for it. You put your vote in there. Thank you. You did great. You led well. And so we have a new dawn. I think Ian said it. We have a new dawn in Africa. We have the resolution, and I dare say we have a new ASLM that is invigorated with very strong leadership. So there's a huge opportunity that I see here. The question is, what's going to be your contribution and my contribution? That's what I live here with, and that's what I'd like you to live here with. In Roche, and I come to the end now, we have a 10-year vision and ambition for Africa with respect to diagnostics. We intend to increase the number of tests that we supply to the continent tenfold over the next 10 years. I may not know the specifics of how exactly we're going to do that, but we just declared it publicly, so now we have to do it. What I do know for a fact is we cannot do it alone. And that is why we invite you to come and partner with us so that together we can change those statistics for Africa. Thank you very much.
Ladies and gentlemen, I'm now going to ask that the Deputy Director General of the Department of Health for South Africa, Dr. Anban Pillay, please come back on stage to officially open the conference for us. Please welcome him back.
I know you all have been seated here for quite a long time. I'm sure you're very tired, so I don't want to stand between you and having some rest. So on behalf of the National Department of Health and the National Health Laboratory Services, which is an entity of the National Department, we'd like to declare this conference open and wish all of you all the best in terms of the various presentations that you have, and we hope that there will be fruitful discussions, and at the end of this conference that we'll come out with recommendations which we can implement and remember the ASLM 2023 as a historic conference. Thank you very much.